think in this age, with a lot of information available, it's very hard for people to sort out whatever the symptoms or problems they have. So it's helpful to have internet, and sometimes people come in being alerted by something they read, and it could be good because otherwise they might have ignored something, or it could be not so good because they come in and they're really stressed over something that maybe they don't have. So I find it to be a very interesting area, and it's very challenging and rewarding as well when you talk to people, you maybe reassure them, and it makes a big difference in their overall health. I think I would like to really encourage people to come in and talk about problems. Oftentimes I see someone and they have something, and I say, well, that's really not something concerning. This is seborrheic keratosis, for example, which is completely benign skin condition. But how long have you had that? Oh, I've had it for 6 months. I kept thinking about coming in, and I did not. So in other words, for 6 months, you were worrying about something. It's not good. It can stress someone out and bring an anxiety that maybe wasn't there. And there is really no reason for that, because it's easy to make an appointment and just talk about it. A lot of problems we can solve. A lot of other problems we can at least sort out and make sure that's not something major. And sometimes we cannot tell what is it exactly. But as long as we know there's not some sort of a major problem, and we're sure of that, we can reassure the patient. So if the symptoms are mild but very worrisome, they can live a lot easier with those symptoms after they talk to a physician about them. So I always, sometimes people say, oh, I feel funny about coming in, and I hate to waste your time. I'm sure there are people with a lot of important problems in comparison to me, but I really always say that it's great that you came in. I would so much rather that we talk about it than you worrying about it and actually getting more problems that way. I absolutely love it. I absolutely love it when we can put some worries to rest. And I don't just talk somebody out of problems. I'm very thorough, so I do a thorough workup. I cannot just ever say, well, I think it's nothing, unless it's absolutely 100% obvious. Most of the time, I have to do certain blood work. We have to do a couple of tests. Not anything too extensive, but it will be a lot better for us to rule out the bad things and just basically put our mind at rest about that. After medical school, I was interested in endocrinology. Endocrinology, if some people you listen to some people, they would say that it really is the basis for medicine. And if you stop and think, so many people have diabetes, it's so prevalent, and that's endocrine. So basically, I started endocrinology after medical school, and I did several years of training. Then when I came to this country, I had residency, which was just an internal medicine, but endocrinology was always my interest. I took extra rotations in it, and actually eventually I was working with the person who was training me in residency, Stuart Chipkin. He was the chief of endocrine at Bay State, and I was working with him eventually at Valley Medical for multiple years. So we worked together, and it still is the area that I really enjoy. Whether it's diabetes, thyroid problems, a lot of women reproductive problems, menopausal problems, osteoporosis, it's really the area that I very much enjoy, and there's always something new that's coming out, something that's encouraging and gives a lot of hope for diabetes and also for management of osteoporosis especially.